Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Yeah, so I've been on and off the platform. I had quite some good successes, and I came on and asked a question last time, and it was basically revolved around my neck, and neck strengthening and loosening at the same time. I think this is mostly probably be aimed at you, Cam, from that perspective. So I've sort of came away and I tried to sort of incorporate my own program in terms of strengthening and loosening the neck at the same time, and I've watched the seminar. Specifically on the neck, which is on the resources on the website. I think what's happening at the moment is I'm getting to a place where, so what I do is I get a lacrosse ball and I basically massage my suboccipitals with that. So I lie on the floor and get quite deep into that for about 2 minutes for 3 sets in the morning. I was doing acupuncture at the same time as well, and having Botox injections to see if that works sort of around that neck and loosening. So I'm on top of that. It's just as soon as I start strengthening, or as soon as I start probing around the sort of mobility side of my neck, it all seems to go south. I think it was last Sunday. I'll just show you. I was doing some like chin tucks like this, and then lying down and lifting my head off the floor just to strengthen around that neck and that sort of area, with some sort of reverse flies and some other things related to that. And then a day later, my eyes are just so sore, and it just lingers for weeks afterwards. So I can't really gauge that. I just can't get it right. I don't know what it is. I'm struggling what to do next going forward.
What are your main symptoms? Is it mostly just headaches or head pain?
So generally it's my eyes. So it all comes to the forefront of my eyes, and they just feel really, really bruised and really sore. It does settle. It does settle down, but it's as soon as I start probing from a mobility point of view, as soon as I start doing like these chin tucks and sort of a pinch, there's a slight pinch in my neck, it triggers me off straight away. So there's obviously a lot of avoidance during my recovery. I have avoided that a lot because it was always the case of I'd settle down, I'd try and get back in the gym, and it was the one thing that would always just trigger me off again. And it was that cycle, and I started doing my vestibular rehab again, but I'm quite despondent with that, just because I'm fighting a losing battle with my neck. And I know like 80-90% of my symptoms going from my neck. I just can't get on top of it.
Right. Now, but when you say like it goes to your eyes, like do you feel like you have like visual issues, like kind of dizziness or motion issues, or is it all just like pain and pressure?
Yeah, so it's a bit of both really, but it's all governed by if my neck's tight, I can feel it a bit. My eyes, my vision's not been great recently. I got to a point about 2 years ago where I was pretty much fine. I had no symptoms. I was exercising a lot. I was doing everything I possibly could. Again, it was just getting back in the gym and doing weights is the one thing that just throws me off every time.
Right. So now you're doing your own kind of soft tissue release, right, to the suboccipitals.
That's right, yeah.
A lot of times the suboccipitals are a symptom of the problem, but they're not the problem themselves, right? So a lot of even practitioners will go right to the suboccipitals and they'll do a lot of work on the back of your neck, but a lot of times the reason that the suboccipitals are tight is because you have a lot of tightness through the chest that pulls everything forward, or your SCM muscles are tight, and those start to mess with vision, and those can also cause kind of pain in and around the eyes and stuff too. So the SCM muscles and the deep neck flexors are another common one that's associated with visual symptoms, and another reason that the suboccipitals could be impacted, right? So if everything's pulling forward, your deep neck flexors get weakened, but weakness and tightness kind of go hand in hand. And so, yeah, you might release the suboccipitals, get a little bit of temporary relief, but there's still dysfunction, right? You're loosening off the back, but are you doing anything for the front? Are you getting any soft tissue work around the SCMs or the deep neck flexors?
No, I was getting some. I did see someone in London, but they're so expensive.
Yeah.
It wasn't really feasible, and I'm sort of at the stage where now there's a lot of trial and error involved, and I'm struggling to justify that sort of financial impact
Yeah.
for things that may or may not work. So it's a tough balance, like getting it right. If I knew exactly what I needed to do, and I just neck um watching the neck seminar on the program, there was three things when there was like it was the tightness, and then it was like a pinch was that right? I don't
Yeah.
think I'm saying it right. I think I've got that, but again, I don't know how to address that.
So
Um,
if it's pinching, usually what it is a joint problem. So you need to get some adjustments to release that, and it's not something you can really do on your own.
yeah,
And in the
it's not
UK,
necessarily chiro though, is it? Is it chiropractor or?
yeah, it could be a chiro. Now it's difficult in the UK because I don't think a lot of people do ART there, and so it's harder to find the right type of people. But like what I find for your type of thing, like when people are saying like, "Oh, I have these like visual issues," a lot of times it's like the SCM muscle and the deep neck flexors. So when you say you watched the neck sessions, did you watch the latest two on manual therapy?
No, I think I watched the specific neck one. I think it was from like 2022. So yeah,
Okay.
it was probably up.
So there's two I did recently. It's manual therapy part 1 and manual therapy part 2. I would say go and watch those because that'll just give you a little bit more insight. They're way more in depth, obviously, because it's a two-part series. Um, and that might just give you a little bit more insight as to what you're looking for. And we also talk about some of the rehab that goes with that. So the problem is like strengthening exercises, if you have dysfunction, will flare you up like you're experiencing, right? Because if you have, like, let's say something is really tight in the front and you're loosening it off in the back, that's fine, but it just creates this imbalance. And then you do strengthening exercises, your body's going to move um, the way in which your tissues allow it to. Right? So if I have a shoulder injury, if I'm doing just like strengthening for my shoulder, I'm generally gonna try and move to avoid that painful spot. And it's gonna create this kind of weird movement pattern. And am I really getting to the point where I need to? So my approach generally is let's loosen things off, get things moving properly first, then we can start to strengthen. Because if we strengthen too early, then we might be in a situation where we have these abnormal movements. And that might be what you're experiencing, where you're loosening off one side but not the other. And that creates a bit of dysfunction front to back or side to side. And then when you do these exercises, that dysfunction comes to the surface. And then you start to feel this increase in symptoms. And so you may just need a little bit more tissue work. So I would watch those two videos just to get a little bit more insight that might kind of help you.
Yeah. Would you suggest doing more like iso hold sort of exercises then rather than movement exercises to begin with? Because it is literally it's like a day after, as soon as I start doing those sort of prone sort of chin tuck movements and start just messing around here, it's almost instant in terms of the reaction I get.
I mean, it doesn't really matter whether it's iso hold or whatever. Like if you engage the muscles, right? So let's say my deep neck flexors are really tight on the left and not bad on the right. And there's always kind of a side to side difference whenever I assess people. Like people have issues with like, oh, when I look up, I feel dizzy or whatever. You have this kind of side to side difference there. Now, if those sensors in your muscles, they will detect tension. So when you contract the muscle, there's going to be increased tension in the muscle. When you stretch the muscle, there's going to be increased tension in the muscle. But if one side is already under more tension, it's telling your brain that your head is maybe rotated slightly or tilted slightly. And when you then add more tension to that, you're just going to have, there's like a differential between the sides, the side to side. And then as you recover from doing that strengthening exercise, whether it's an isometric hold or a movement based exercise, that differential may start to just cause some some kind of disequilibrium within your system where you're like, okay, your brain doesn't really know where you are in space. It starts to create this system. If there's any kind of, functional instability there, you're going to have, everything's going to tighten up now as a response to that because it's trying to stabilize things. So usually my first step, and this is in those videos, but generally my first step is like, get good tissue work to loosen it off. And there's examples of me actually treating somebody in those things, so you can see exactly kind of what I do and what you're looking for. Finding it is another is another question though.
Yeah, that's the biggest issue.
I know it's the biggest issue for us in terms of referring people within this program to try and find, good neck treatment is that part. I just wish I could get my hands on everyone because I would just be able to be like, okay, let's do this. And then you'll see it like right away. Like I did a seminar the weekend before in Quebec. And there was a girl there that has persistent symptoms, and I just gave her a quick little visual assessment, and then kind of I incorporated her neck into that assessment to try and see how much the neck was involved. Found a few areas that were there. I was like, hey, let me just work on her. I worked on her for 2 minutes, and then I did that assessment again, and dizziness was gone. Right. So it can be that quick if you know kind of what you're doing, but trying to find somebody who's able to do that is the challenge. But if you go and look at that, it'll just give you a little bit more insight into things you may be missing. And yeah, that might open it up for you. And then after that, maybe come back and ask some questions if you're still kind of.
Yeah, okay. Because could it be a case, I have thought this before, I mean, I just feel like most of my symptoms now are quite superficial because it has been going on for so long. I mean, is it a case of just pushing through the pain and just what my head might just come to some sort of equilibrium?
In some cases, pushing in is okay because you'll kind of adapt to it. In other cases, it just continues on with it. So it's hard for me to say from where I am right now without like assessing you myself. You may want to just go back to just getting like the soft tissue work first until things are like good, and then start to do a little bit of proprioceptive and then some strengthening after that. If you're doing, you might be just doing the strengthening too soon and you're just not ready for it yet, and that's why things are flaring.
I know, because I feel like I'm at that stage where I can start strengthening, and I just seem to get it wrong every time. Unless the strengthening is just again too much to what I'm doing, but it doesn't seem like a lot. So it's just getting that balance of where it's right. It's just so difficult.
There's one device that I've seen that's really good for people in this situation. It's called the Topspin 360. I've talked about it before, but it's expensive, and generally it's run through like a clinic. But if you wanted to get it yourself, I think it's like $3,500 to get it. But it's like a football helmet that you put on, and it has like a rod on it that spins, and it works really well. It works really well for like developing kind of like a more uniform neck strength and stability, which is what people like you need. So you could look into something like that. We have formed a partnership with them through our clinics. So some of our clinics now are starting to purchase these devices to use as part of their rehab. I don't think any in the UK have done so yet. But if any do, then I can kind of put you in that direction to maybe start incorporating that, because I think that is one of the best things I've seen in terms of like improving neck stability.
Yeah, I heard about that the other day actually.
Yeah.
And there's I came across an iron neck.
Yeah, that's not going to be the same thing. That's kind of more like overall like kind of brute strength. This is more stability, which is where I think the issue is. It's not that you have like a weak neck, it's that maybe you have a little bit of instability. That's usually what the issue is.
Yeah, I mean, I've definitely got some sort of muscle atrophy as well, just because I haven't been to gym in years. So, and off the back of rugby, I've got some other issues
but
going on.
like rugby's going to cause like repeated kind of neck injuries that are going to cause dysfunction over time, right? Just based on the nature of the sport. So I would go back, watch those 2 manual therapy things, see if anything kind of resonates or things you might be able to incorporate to help. Maybe look into Topspin as a potential kind of option down the road. And then I'll reach out to some of our UK clinics to see if anyone has gotten on board with it yet.
Yeah, that'd be fantastic.
We have a really good clinic in Bristol. It's a couple hours from you.
Yeah, I think I went down there a few years ago, actually. I think the guy that was there, Chris, left or something. But
yeah, he might have. But there's other people there as well. But I'll see if they're getting on the Topspin thing, because that might just be something additional that could be helpful.
Yeah, no, that'd be great. Lovely. Thank you very much. Thanks,
You're
Cam.
welcome. Yeah.
Cheers. Thank you.
Yeah. Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.